Hi, this is Dr. Dave. I've had enough, honestly, of all these people on social media claiming to know medical research, citing very wild claims, fear mongering, and it's very frustrating to me because a lot of them don't truly understand how to analyze and critique a medical paper, like a scientific paper, and how to do it properly and to make sure you're coming up with the right conclusions from that paper. Just reading the introduction or the abstract and their final conclusion is not enough. You need to have critical thinking every time you take any sort of research paper on its merit. And this is why there's a peer review process, why there's a whole system that is structured around ensuring that high quality articles are published. Because I kid you not, there's thousands of papers being published every single week that are very poor quality, not needed, not designed the right way, are promoting false, sensationalist claims that then the news get a hold of, and then you hear it on the news. But really, it's now your responsibility to understand what kind of information you're accepting, what's the quality of that information, can you trust it, and also to have a sense of, okay, I'm reading this medical paper, how do I know it's good or not? And so really, I want to create a brief course. This is for a non-medical lay person who's interested in wanting to claim more ownership and more responsibility for their health and making better decisions for themselves. And this is a course basically on how to review medical literature. I'm going to keep it very surface level, give you enough of information so that you can realistically approach any paper and get a reasonable conclusion out of it and make better decisions. And if you have questions, concerns, please comment, and then we can go into more depth as needed. But essentially, I just wanted to put this out there because really, I don't see anyone teaching people how to read these papers. And so that's the problem I'm hoping to solve. And hopefully this is helpful to you. This is going to be a 5-part series. I'll create 5 different videos and, we'll focus on different topics in each of them. And so please feel free to follow. I'll upload the videos pretty much regularly. So essentially, my name is Dr. Dave. I'm trained in internal medicine and ICU. I did all my medical training at a medical school in Canada. I did my undergraduate in biochemistry with a honors thesis, so I did a whole research project as well. And then did medical school, residency in internal medicine, ICU. I've had countless publications, more than 30. You can see some of them in really high impact journals as well, both related to critical care and medicine, as well as in AI, which I'm also a part of. So if you want to look up my whole credentials, you can go to my website, drchintandave.com, and then you'll see all my publications there. But hopefully this is helpful for you. So let's get started. My goal again is to make it very simple, okay? And so if you're already an expert or you're already in the field, then this course may not be beneficial for you. So first module, I want you to understand why it's important. I mean, I think we all know why medical research is important, but ultimately I want to provide a guide for you to read and analyze these medical studies, understand what the research is and how to make informed health decisions from that research, and then also identify red flags, identify misleading claims, and so you can protect yourself from very clearly flawed studies. And it matters because honestly, this research is what dictates a lot of things. It dictates how patients are cared for, how your high blood pressure is managed in the clinic, how, when a patient's on the ventilator, how we manage that patient who is on COVID and on a ventilator. How did those decisions get made? It's through this medical research. And so this is a fundamental foundation for how medical decisions are made. And so it's crucial for you to understand how doctors are making this and how, guidelines are being created. So this is actually very crucial knowledge. Also, this is good for individuals because once individuals are more empowered to know how to make these decisions and how to interpret these studies, they can make better decisions for themselves. It's also essential to identify what's effective and safe, and this is how a lot of new medical testing, medications, interventions, devices, they undergo this rigorous testing. And then also understanding the research helps you understand how misinformation spreads, because not everyone is capable and not everyone cares, to be frank, to dive deep into the research to make sure that their claims are valid. It's much more easier to read the conclusion and read the abstract of an article and then make a TikTok or an Instagram video about it for 30, 60 seconds and then make some false claim to get views, whatever, to promote their own agenda. So really, it's in your best interest to understand how to do this. The evolution of medical research really, I'm going to keep it very simple. Again, it started as a trial and error. You try different things, you observe, people make note of it. And then ultimately we have like the scientific methodology where you come up with a research question, we call it the PICO question. You know, it's like what research question are you answering is very important as researchers to delineate and identify that. And every research that's published will have a research question or a thesis or, you know, what their objective, what they're trying to assess for. And that's very crucial for you to keep in mind. Clinical trials essentially revolutionized medical research because it gave us a way to minimize bias and you know, create a more larger scale of evidence, larger body of evidence. And then there's some ethical frameworks here too, but essentially the shift has gone from anecdotal evidence that, hey, you know, this worked for me. Like 4 different doctors would say 4 different things what worked for them, to evidence-based medicine, which is evidence gathered over a large body of population, large body of evidence based on larger studies. So the type of medical studies, briefly, you have randomized control trials. This is the gold standard for any question that you might have, any interventions, anything you want to test. Randomized control trials is the way to go. You essentially randomly, you take like 1,000 patients, let's say, for example, and you randomly assign them to a control group and an intervention group. I'll go into full details about the different types of study designs later, but randomized control trials is the gold standard. You have cohort studies, which essentially observes groups of people over time to study how the disease develops. And then case control studies compares individuals with or without the condition to find what risk factors might have contributed to that condition. So maybe someone has a rare type of cancer. So then you find 100 group of people with that rare cancer and then 100 group of people without that cancer. And then you look backwards, you're like, oh, what kind of risk factors was prevalent in the people with the cancer that wasn't present in the people without cancer? And that's how then you can say, oh, you know, exposure to smoking, for example, is associated with this rare cancer. So that's case control studies. Systematic reviews and meta-analysis is essentially the strongest form of evidence that you'll have. I'll go back here. I can't go back. But anyway, systematic review and meta-analyses are essentially when they take a bunch of randomized controlled trials. So if there's 10 trials, each had 1,000 patients, assessing the same question. Let's say are cholesterol medications good for lowering cholesterol and lowering heart attacks? That's the question. There's 10 studies that looked at it, 1,000 patients each. A meta-analysis systematic review would put all of them together and then look at the net effect. And so that's the most strongest evidence we have. Peer review is a very important part of the process. And peer review essentially means that before you can publish your research on a reputable journal, you have to get it evaluated by other experts. And usually there's 2, 3, or 4 peers who are experts in that field. For example, if you're doing a cholesterol medication study, there'll be cardiologists, there'll be, you know, pharmacists or whatever, whoever else might be part of the committee there to do peer review. They'll review that research and try to find flaws, try to find, you know, where it's not complete and try to address that question. And then you usually send it back to the researcher saying, hey, there's a major flaw in your study, can you fix this? The researchers fix it, submit it again, and then usually maybe after a couple of rounds of edits and reviews, usually a paper gets admitted to a publication to a higher quality journal. But this is where it's important because there's different levels of journals. There's like really high impact factor journals that are high quality, very reputable, high standards for publication, meaning any minor flaws even, they'll flag you, they won't publish, or they'll say fix it before we even consider. And then there's very lower level journals as well that have no standards. Sometimes they don't even have a good peer review process, and they publish essentially lower quality research. And so it's, you know, it's not black and white, but it's a spectrum. And so you need to be careful about that. It matters because, you know, if someone's just able to publish their paper without anyone else in that field who's an expert, who's able to review it, then how do you know there's no errors in there? How do you know there's no fallacies, no biases? How do you know you've taken into account for a flaw that maybe that one researcher didn't look into? So it's a very crucial part of it. Though there are limitations to the peer review process, you know, there's definitely flaws to it. Again, it's not all high quality. Peer reviews themselves, the reviewers themselves have some biases. Oftentimes the reviewers will be like, hey, can you cite this paper? And their paper is like something they published by themselves to like get more exposure for their own research. So there's definitely flaws to it, but it's the best process we have so far. Ultimately, there are so many retracted studies, you know, fraudulent COVID treatments, which I'll talk about in a bit. And then peer review is not, again, foolproof, as I mentioned. So how do you find reliable medical research? I think these resources you should keep in mind: PubMed, Cochrane Library, JAMA, NEJM, BMJ. These are like highest quality research journals, and they'll publish the best quality research. And these studies published in these journals are the articles that change practice, are the articles that say, hey, this is the next standard of care, this is what we should be doing. So it's crucial that you understand what these findings are. Some of the red flags you should keep in mind for your publication, if you're trying to take into any account any finding, is make sure it's not from a predatory journal, which again are hard to identify, but realistically you can look at the impact factor. You can search up the journal name and then search up impact factor, and the impact factor is like really low, like let's say 1 or less than 1, or 1 to 2 is not great. 3 and above is better. The higher the impact factor, the better the quality of the journal. And the reason the impact factor essentially just means like what is the impact that each publication from that journal has on the broader community. So the lower the impact, obviously the poorer the quality of the journal and their subsequent publication. So look at the impact factor. That's how one way you can identify. 2, look for whether there was any rigorous peer review process. If there was no peer review process, then I would really think highly critical of those findings from that paper. Again, pro tip, avoid any health claims based on one single study. One single study is not enough to change the whole paradigm or change the whole fundamental basis of medicine. Yes, maybe that one study is really good and it gives you a hypothesis like, hey, this may be something to explore, but definitely needs more evidence. And so look for the body of evidence. And this is usually, if you can find a systematic review or a meta-analysis of that one question, that's probably the best source of information for you. PubMed, Cochrane Library, again, are very trustworthy sites to go to. Maybe I can show you how to navigate through that in another video, but essentially you can just search them up, search for the questions you want, and it should be pretty straightforward. Just another caution note, I'm sure all of you know that the news headlines are not reliable. And now extrapolate these news headlines to headlines that you see on TikTok videos, Instagram videos, sometimes even YouTube videos. You need to be careful that you're not just buying blindly into whatever's being sold to you, especially as it relates to your health. Take some ownership, make sure you're able to make the right informed decisions for your health. There is some open access journals, which I'm a big fan of, because these journals essentially publish their research for public access without having to pay any money. The other articles, the other journals I talked about, like JAMA, NEJM, all those higher quality journals, they usually require subscription, institutional access, or you have to pay a lot of money per article. One way you can get around this is you can actually email the authors, and the authors will email the paper to you, the PDF to you, at no charge. So if you're able to do that, do that. It's a nice little workaround. But I mean, you can't do that for hundreds of articles, but for a couple that you're really interested in, it's a good way to do that. Preprint servers are, you'll find them everywhere, like Bio, RxIV, and stuff like that if you search for preprint articles. These are servers that allow researchers to share studies before they've undergone peer review. Now, there's 2 types of preprints. There's preprints that they just publish and then that's all they do, and then there's preprints that they publish to get the information out faster while they're waiting for the peer review process, because the peer review process sometimes can take 6 months or longer. And so they want to get the information out. And during COVID, it was very popular to get a lot of the articles out onto preprint. But the challenge here is preprints, nobody reviews it. I can literally just go and upload a PDF and publish it onto a preprint. And I could write anything I want into it. Nobody checks it, nobody verifies it. I don't need an ethics board approval. So I could do any study, or worse yet, I do no study and I just make up all the data and I could put it onto a preprint database, and that's horrible. So this is why, a lot of actual scientists and academics will not really weigh heavily on preprint research. But open science overall increases transparency, and I'm a big fan of that. There were a lot of preprint studies, as I mentioned, during the COVID time, and some of them were retracted, which I'll review here actually. When you're studying different types of study designs, one important question to ask is, what is the question they're trying to answer? Because based on the question, the study design is going to be relevant to that. Because if the study design and the question are mismatched, maybe you want to know whether this intervention will improve outcomes, but you're just doing an observational study. That's not as robust of evidence as doing an RCT, a randomized controlled trial, for that. And this is why observational studies can be misleading. Observational studies more so identify correlations for you, so they're hypothesis generating. They'll tell you, hey, this thing might be related to this thing, but it doesn't tell you that they're causing this thing. For example, if a observational study found that during summer times there's an increase in ice cream sales and drownings, then a causation would be, oh, buying more ice cream leads to more drowning. But that's not a causation, because that study did not look at causation. It just looked at the correlation that, hey, both of these are rising. Could be independent, could be dependent, we don't know, but there seems to be a correlation. This needs to be explored. And so that needs to be explored with another study, is how you would answer. I hope that was helpful. Some key takeaways now for you to remember is that the study type helps you determine the credibility of those findings. Always check for peer review and the sources. Where is it published? Did a good journal? Did they do peer review? Multiple studies obviously are better and stronger evidence than one study. Critical thinking is very crucial for you, and I would not just take the conclusions of any study, even if it's a high impact journal. Don't take the conclusions as fact. You want to always come with skepticism. Ensure that you fact check all medical claims, especially if you hear it online anywhere. Check it for yourself if you're really worried before you make life-changing decisions. And then lastly, I want you to think, the next time you see a health claim, ask yourself, where's the evidence? Go look for it for yourself and make better decisions for yourself. Stay tuned and follow for more. The next videos, I'm hoping I'll make them much shorter, more to the point, and I'll leave you with a template as well, which will allow you to just use that template to kind of go through some of these questions and thinking with each paper, and so you can use that. I'm going to link that for free. But yeah, please follow, share, subscribe. I really appreciate the support. Thank you.